All right. Okay. So it is 12 o'clock. So we can go ahead and get started here. Thanks everybody for joining. So today's learning community event will be focused on lower carbohydrate diets, and we'll be discussing the quality improvement efforts that have been done by the POs that have selected low carb diet as their QI focus for this VBR cycle. We're joined today by our registered dietitian for MCT2D, Rina Hisamatsu. She'll be helping to facilitate today's call, and I'll be handing it over to her in a moment here. Before we get started and diving into the actual content and talking with our panelists that'll be presenting today. And if you are a panelist, please feel free to come on screen and get yourself all ready. Rena will be calling on you to answer the questions after we get started here. But before we do that, we're going to go through a couple of our standard slides. And so this is, as all of the others, eligible for CME if you attend and are here in person. If you are watching a recording of this later on, obviously CME is not available, but you can complete the quiz for this and obtain your physician level VBR credit. Still, so here are the couple of slides on getting CME for attending a live session. A couple of call outs here for the actual CME process. And these slides will be distributed, so you'll have access to all of this information as well as always. As a disclosure, our MCT2D program director, Lauren Oshman, does have publicly traded stocks in a few industries, including pharmaceutical companies such as AbbVie, Johnson & Johnson, Lilly, Merck & Company, and Organon, and device manufacturer Abbott as a disclosure. And then as a new procedure, if you were not on our last learning community event, in order to help us link your attendance for VBR purposes, we do have a new sign-in procedure for this. So this will be distributed after the meeting. And so if you attended today's call, you'll get an email from us with the slides and the link to sign in. Last meeting, we put it in the chat, but what we noticed is that we kept having to put it in the chat as people joined. So as long as you were here, you'll get an email with the slides and the link to sign in and just say that you were here so that we can match you up. It'll make things a heck of a lot easier on us. We are able to match it to your Zoom attendance. So, all right. So with that, I'm going to turn it over to you, Rena, to help start our facilitation and introduce our panelists.
Thank you so much, Jake. Hello, everybody. My name is Rena, and I'm really excited to facilitate our QI panel discussion today. We're really excited to have representatives from each of the three physician organizations who participated in the low carb QI initiative. And our panelists are here today to share their experiences with us. So we have from Livingston Physician Organization, we have Renee Clark and Alex Tracy. From Oakland Southfield Physicians, we have Molly Mason. And from Covenant Healthcare Partners, we have Sam Flory. So welcome and thank you all so much for joining us today. All righty. Oh, there isn't. Okay. All righty. So in terms, I wanted to provide a quick recap here of the QI timeline. For everyone who's attending the call today, we want to summarize the timeline of events that we followed throughout the VBR year for the low carb QI teams. The low carb diet QI initiative was approached differently compared to the other two QI focuses, CGM and medications, mainly because we don't exactly have the data in the dashboards that can provide information to us. And so we had to really rely on patient-reported outcomes or PROs as our primary way to assess change. So what you can see here, we started out in the VBR year started out in September, in which the POs determined which focus to settle on. And you can see that we have a timeline of 2 rounds of PROS surveys that we disseminated throughout the VBR year. So Jake, if you don't mind going to the next slide, please. Thank you. All right. And so this is a little bit about the low carb PROS. So we had 3 POs choose and focus on the low carbohydrate diet as their QI focus for this VBR year. We had 2 rounds of surveys that we distributed to the practices to disseminate to the patients. And so we had our first round of surveys that we requested the practices to distribute to any patient with type 2 diabetes between October of last year and January 2024. Here we wanted to ask about anticipated or experienced challenges around the low carbohydrate diet relating to the resources, provider education, and support. We received an overwhelming number of responses from the surveys. We had about 400 surveys come in, which is really amazing. And I'll share with you all kind of a high-level overview of what the survey results from that first distribution looks like. Okay, so in regards to the in the survey we talked about, or we asked respondents who have tried a low carbohydrate diet, kind of share with us what their top three barriers were. And from the survey, we found that the top 3 included cravings for carb foods, difficulty to sustain long term, and challenges navigating social gatherings and events. Other barriers that were mentioned are motivation, juggling multiple comorbidities, and external factors such as traveling. So respondents who had not tried a low carbohydrate diet were asked the same question, but framed in a slightly different way. So what factors concern you the most about starting a low carbohydrate meal plan? So we actually received very similar results, which included difficulty sustaining the meal plan long-term, lack of knowledge around or needed for meal planning and cooking low-carb meals, as well as carb cravings here as well. All right, and so the next sort of theme that we want to highlight is among the respondents who have tried a low carbohydrate meal plan, almost 40% wanted additional support with low carb meal planning and recipes. They really wanted resources around, lists of low carbohydrate foods, low carb substitutions. So really kind of tangible takeaways that they can implement into their lifestyle at home. Additionally, we also asked participants who have not tried a low carbohydrate meal plan to choose what types of support and resources they felt would most likely or be most helpful for them if they were to try a low carbohydrate meal plan in the future. And interestingly, we actually saw a lot of overlap in responses among those who have tried and those who have not tried a low carb meal plan. So the top 3 responses here were very similar: low carb recipes, meal planning strategies, lists of low carb foods, substitutions. All right, and so here, this is a summary, kind of a summary from one of the open-ended questions that we asked to all participants or all respondents who participated in the survey. We asked, how can your care team best support you to be successful on a low carb meal plan? And so I wanted to summarize the 3 themes that we gathered from these open-ended questions. Participants wanted ongoing support on low carb diet education with resources and follow-ups, which really goes hand in hand with ongoing support and check-ins, to assess progress, continued discussions around patient-centered goals and their care plan. I also think this really speaks to the importance of meeting the patient where they're at and identifying what their biggest needs and struggles are so that we can provide really the best support for them to achieve success. All right, and so with that, let's get into the Q&As, and we'll have our panelists, because we have not that many POs in the QI or low carb QI initiative. We'll have we'll go through each of the questions and we'll have each of the panelists kind of share their experience and share their response for each of these questions. Okay, so firstly, how did the pros collection, excuse me, process go? Do you have any lessons learned or best practices that you can share? Um, I'm also curious, I think one thing I'll add is, were there any differences in the pros collection process between survey 1 and survey 2, which is what we're wrapping up now? So I, I yeah, I think what we will do is maybe from Livingston Physician Organization, Renee and Alex, maybe can you share your thoughts first?
Sure, I can do that. And I think it's funny that you said that there was an overwhelming number of responses because we felt like we had to struggle to get every single one of them. Patient engagement definitely was an issue when we're giving out a handout to the patient for the surveys. We're sending an email as a follow-up to the visit. We weren't getting a lot of responses back. And to get a good response rate back from the patients, it really needed to involve the provider and having a follow-up maybe with that care manager afterwards when they're following up on the low-carb diet. And that's really what we took into the second round of surveys, is getting that initial from the provider and then following up later with the care management.
Thank you, Alex. Did you feel like the second round of surveys, that process worked well, sort of after implementing some of those changes in terms of following up with patients?
I feel
touch
like
base.
we had a lot better of a handle on the process. We were able to kind of step into it already knowing what we wanted to do. And there wasn't any of the initial fumbles like we had with the first round.
Gotcha. That's really great to hear that. And that's really awesome that you had identified maybe some of the areas of the challenges and made those changes to the second round of pros and had found that to be helpful to hopefully receive more engagement from patients and responses as well. All right. How about Molly from Oakland Southfield Physicians?
Hello, thanks for having us today. So we also struggled with the PRO collection. I think the timelines felt tight at times because we were trying to understand the requirements and make sure we rolled it out in an appropriate way to the practices before the practices actually began collection. And so the amount of time that they had to sort of work with their patients to get those responses and became a challenge for both of the rounds. We had a little bit more success with the first round of surveys, and I think that was probably related to the fact that the patient didn't have to be following a low-carb diet the first round, so our pool of patients to pull from was a little bit smaller in the second round. And then we also struggled a little bit with our practices, just sort of understanding the requirements of the survey in terms of, was it appropriate to call the patients? And so that is something in terms of lessons learned, just making sure from a PO perspective that we are making sure that our practices understand what's being asked of them moving forward.
Thank you, Molly. Yeah, so it sounds like the fact that survey number 1 was, could be distributed to any patient with type 2 diabetes, that really helped to kind of increase the pool of patients that you can disseminate the surveys to, but also having a streamlined and easy and really straightforward kind of process and workflow for physicians and other providers to pass out these surveys was really important and a key to the success for your practice and PO. Awesome. Thank you so much, Molly. And Sam, how were your experiences with the collection process?
Good morning, or well, good afternoon now. I wasn't there for the first collection period. I was off on maternity leave, but I do think that we had more success the first round, and I think that has to go from like the patient could fill it out right then and didn't have to wait the 6 weeks. I think that's where we struggled on the second round, was that patients would agree and sign up. We had a lot of like interest, but the follow through in the 6 weeks was hard to make sure that they did that. We did have one office that would have the patient sign up when they were there and prescribe the low carb diet, and then they would just follow up with them to make sure like, hey, this survey should be coming, make sure to fill it out, and that worked well for them. But a lot of our offices do not have the staff to accommodate that. So I think we had good results overall, better with the first than the second.
Amazing. Thank you, Sam. Yeah, I really liked what you said about having, a dedicated, like a staff member there to kind of just be that reminder and to touch base with the patient sort of 6 weeks post their initial initiating the low carbohydrate meal plan. That kind of 6 week follow-up, sometimes it can be we might lose some folks in that timeline, but having someone to kind of reconnect with the patient to remind them can be a really helpful strategy to retain engagement and the survey completion as well. It sounds like the 3 POs. I think the area of challenge was really it sounds like there was some challenges around getting or disseminating and collecting survey responses. But I hope that kind of seeing that we actually received really a lot of responses from survey number 1, as you saw. So I hope that that's a relief as well from you all to kind of see that there actually was a lot of great engagement from patients in your practices. All right, let's go to the next question. So what did you learn from the first round of low carb pros, and how did you use this to guide the support your practice provides patients? And I think, so this question, I think is potentially more geared towards the individual lessons learned, right? So from you, the 3 panelists, the clinical champions, and how you use the data from the survey responses to support your practice to improve the QI initiative. So let's see. Who wants to answer first? Or I can call
go
on.
first.
Okay, awesome. Alex, how was your experience here?
So what we really learned from it is that the patients were asking for more support from the practice. They wanted more frequent check-ins from the care managers. We also had some providers bringing patients back in for appointments more frequently just to discuss their diet and how that affects their diabetes. The other thing we did is to create some additional materials. We started with the low carb poster that was provided by MCT2D, and we split that up into individual handouts for the patients so that they could take that with them and still have that QR code. Either when they're waiting in the exam room or they're waiting in the waiting room in the office, take a look at that low carb video. So that was available even for patients that didn't have diabetes, if they maybe were interested in low carb diet.
That's fantastic, Alex. It sounds like, with the dissemination of these pros surveys, it really helped to facilitate more regular check-ins with patients. And I think that's a wonderful change. And hearing how the creative uses of the low carb resources is amazing too. I heard from one of the practices that they use the low carb poster and they cut it up into individual resources and made them into keychains. And that was something that was really having a lot of positive feedback from the patients as well. So that's fantastic. And using it during like the rooming and the waiting time, I think is amazing too for them to be able to look at what resources are available. All right. Molly, how about from your PO? What's been the experience there?
Sure. So Oakland Southfield physicians, we saw that 35% of the respondents from the first round of PROs were interested in paper resources for education. And we were also hearing that from our clinical champions. So it aligned nicely that the patients were looking for the same thing as what the MCT2D clinical champions were. So what we did is we took that and created an OSP, we called it a low carbohydrate handbook. So there were some resources. I'm a registered dietitian by trade, and so there were some resources that me and my colleague had created. And then we also used some of the MCT2D low carb resources, and we went ahead, we OSP printed and bound them into a book to actually hand to the patient so that all of the handouts were in this handbook. And then that allowed the physicians to then go ahead and hand that handbook to their patients when they were in the office as sort of a taste, if you will, of the low carb diet, sort of a quick overview sort of what was going on. So that was what we learned and how we sort of implemented those results.
That is fabulous, Molly. Thank you for sharing. So really identifying kind of what type of resources the patients that you work with and your PO works with value the most and would be most helpful, and then sort of making those changes into the patient education and creating those paper handouts. And the book, the low carb handbook sounds incredible. I would love to see what that looks like, and potentially many more practices and sites who are working on a similar initiative can implement this into their practice as well going forward.
Sure, thank you.
All right, Sam, how what about any experiences from your end?
Kind of similar to Molly's, we used the first survey to identify the barriers of our patients and our population, and looked at the requested areas of support and their preferred learning style. And it was surprising for us to see that they obviously preferred in person, but also paper resources. I feel like patients normally get bogged down with paper resources. So I feel like, we think maybe they don't need those, but they do like those. So we used that information to kind of standardize education across the practices. So we were all handing out the same thing to see if that made a difference or not in the second survey.
All right. Yeah, we're very excited to close up the second round of surveys and do some analyses on it, and very excited to share that with you, with all the 3 POs. That's fantastic, Sam, to hear that you've also been incorporating, your POs, the barriers and the struggles identified by the patients, and then implemented some of those changes and strategies around that to resolve those gaps. So in-person paper resources, something that your practices have been really putting an emphasis on to disseminate. Fabulous. All right. Next question is, explain the changes that your practices made around educating and supporting patients on a low carbohydrate diet. So I think there is some overlap and some similarities with the question asked previously. Are there anything else that the 3 POs would add? Any other changes that your practices made around the education component and the support for patients?
Yeah, there were a lot of workflow changes that were made at the practice level. Anything from flagging patients for the provider to discuss low carb diet, whether it's chart review or patient huddle, making sure that we're talking about where this patient is at in their low carb journey, preparing materials ahead of time. So whether it's the survey handout, the education handouts, making sure that those were available for the provider, and they didn't have to go searching for them. Also having the MA or the front desk ask the patient about low carb diet, giving them materials ahead of time, those individual handouts that we created from the poster, making sure that the patient had that available to them so that when they did have time, they could look at some of the resources, have questions ready for the provider, maybe about something that was in the handouts.
That's fantastic, Alex. I really like that idea of having patients review some of the information prior to, like during the rooming stages and during their kind of wait in the waiting room to review resources so that they can perhaps just get ready and think about any questions they might want to ask when they do have that face-to-face time with their provider.
Especially in that initial discussion about the low carb diet, that's when having that patient being able to review that ahead of time, have questions ready for the provider, and maybe have thought about going on a low carb diet a little bit before that initial discussion with the provider.
That's fantastic. I really love this idea. Did you were you able to kind of see some of the changes there from that implementation, from those changes in the implementation process or
We
the
didn't really
workflow?
measure any of the data from that, but just from general feedback, things started to go a lot smoother with both referring patients for low carb diets and also patient acceptance in low carb diets. And I think it definitely does have to do with the changes that we continuously implemented throughout the program.
Fantastic. All right. Molly and Sam, how about any additional changes or workflow changes that your practices have implemented to support patients?
This is Molly. I don't have a ton to add. I do really like Alex's suggestion, though, of letting the patient see some of that material ahead of time to ask questions, because I think so many times the provider gets into the room and, explains something, and then patients are a little overwhelmed and don't know, sort of what to ask or haven't had a chance to think about it yet. And then they leave the office and we don't follow up or, so I really like that. That's a takeaway for me from today. So thank you for that, Alex.
Thank you, Molly. I echo what you said too. I think that's a huge takeaway from myself as well. Especially because I think wait times can be long as well in clinic. So I think just having that time for patients while they're waiting to check in, to review some materials and take a look at some information can be really helpful. I think that can go a long way. All right. Sam, how about you? Is there anything else that you found helpful?
Yeah, we didn't really we weren't very prescriptive with how that they implemented it. I think each office kind of used their care manager and leveraged it that way to get the education out. But I do like Alex's idea of getting it out sooner. And really the only main change we made was the education and standardizing that.
Okay. Fabulous. All right. All right. So the next question is based on the survey results. And this will be just tailored to survey number 1 since we've yet to analyze survey 2. But patients generally want ongoing support and follow-up care from their care team. How did your PO incorporate this feedback into patient care and workflow? So I heard from some of you that I think that, you utilize the results from the survey to sort of increase the frequency and just the regularity of checkpoints and touch bases with your patients. So I think that's really fabulous. And what are maybe some other ways that you have provided that ongoing support and follow-up with your patient population?
So we started planning to use the care managers all along. So having them in place was already always part of the plan. One of the things that we changed is having that more frequent checkup and really working on smaller goals for the patient. And if you can have a weekly check-in, you only have to work on 1 or 2 days of that low carb eating, and then follow up with them and say, okay, how did you do on this? And the other thing that we changed is we changed our approach in asking patients about low carb diets. We didn't just take no for an answer. We would continue to ask them at every visit, kind of taking the approach that we take with smoking cessation, is that you ask every time, and maybe that one time that a patient says, yes, I would like to know more about that.
Wow, a lot of great advice there, Alex. Thank you for sharing. So it sounds like, having a care manager on site has been a really big change, and that's something that you as the PO have always had as part of the plan to implement. And then having a care manager at the clinics, at these sites has been helpful. It sounds like, to be able to for patients to have access to timely care, more ongoing support, those weekly or regular check-ins with them to address goal setting. And I think what you mentioned about the small goals is so important, right? I think it's very important to, it is much harder to sustain changes and work on goals when when you have multiple things to juggle, as opposed to focusing on one thing at a time. And I think that can lead to a lot more success as well. And kind of changing the frequency, making the approach, or, talking about low carbohydrate lifestyles at every visit, and sort of checking in with patients at each of those touch points have been very helpful for your PO as well. So that's fantastic to hear.
We didn't have care managers in office at every office. Some of them are remote, but I think having this type of a program, the patients are more apt to be engaged with care management. So they're following up with the care manager because they're wanting to make that change. Whereas a lot of times with care management, where you're calling about somebody's chronic disease, they're not as interested in talking to a care manager about that. Whereas this, I think they felt, was more a topic that they could discuss with the care manager, and they didn't just want to talk to the doctor about it.
Mm-hmm. Yeah. Did you receive any feedback or hear about any feedback or differences between, you mentioned care managers, not all of them may be in person at the sites. Some of them may be working virtually. Any differences in terms of patient engagement that you receive feedback about based on those differences, or was there engagement from both kinds of types of settings?
It really wasn't anything that we tracked, so I don't really know if there's a difference between the two.
Gotcha. All right. Yeah, something that I thought about anyway. All right. Molly, how about you? What kind of support did your PO, how did you incorporate this into patient care and workflow?
So this was something that was a big challenge for us, because we were definitely hearing from our clinical champions that more education and support for patients was necessary for this to be successful. The hard part is that our practices are short-staffed. Physicians, really struggle to find time in their day to sit with patients for long periods of time. And so this is something that we are still working through to sort of determine how OSP can better support our practices in this initiative, knowing that they just don't have the staff or the bandwidth. A work in progress, I will say. because we do know that this is something that is very important for the success of this project.
Yeah, the challenges around staff and bandwidth of staff it's a real struggle. So thank you, Molly, for sharing that and working towards, finding a solution to really improve access for patients and to, increase that support and follow up with the patients that you care for. So excited to hear, continued developments on that progress from your sites. All right. And Sam, how about from your PO? What kind of support and follow-up were you able to implement into the workflow?
I think if they have a care manager, I think they were used. That's like one area I think that we as a PO can improve is we don't have embedded care managers in all of our offices. Fortunately, a lot of our offices do employ their own care manager or have one of our care managers. So that helps with like the education portion. We've also kind of started to transition to include the doctors as clinical champions. So I think that has helped to for them to know like the importance of why we're doing it. And it's not just coming from me, but coming from you guys as well. So I think that's helped kind of, make the changes in the office. Well, that's really it for that.
Yeah, that's fantastic to get as many, providers and healthcare practitioners on board with this initiative. I think is really going to add so much value to patient care. And it sounds like, yeah, having a care manager embedded at the sites really can help to have a designated person that can, address areas and gaps that potentially there may not be time to cover at other routine visits. So that is really great feedback. All right. Okay, so the next question is about what strategies and implementate or workflows worked well when making these changes, and what was harder than you expected?
I think for us, the thing that went really well is provider buy-in. Every provider that we talked to, I think, was really interested in the program and was interested in bringing that to their patients. Other programs that we've done don't necessarily have that level of buy-in from the providers. I think the hardest part we had was actually in the teaching. Even though we thought we had done an effective job of training our providers, patients had questions that they didn't anticipate, or we had to research answers on. And if the provider hasn't tried a low-carb diet themselves, it's hard for them to know what it's like for the patient or to give that detailed advice. So again, we were relying on our care managers to fill in those gaps.
Mm-hmm. Thank you, Alex. Yeah, so really kind of continuing to support, and I think that's where our collaborative really can hopefully continue to support POs and practices to help disseminate and share information about how best practices around the low carbohydrate initiative really kind of share out the tangible resources and things that may be helpful to know in order for practices to be able to provide that support for their patients. That is fantastic to hear. But I'm also really glad to hear, Alex, that it sounds like overwhelmingly there was a lot of interest, generally interest from patients about the low carbohydrate initiative, and there was a lot of positive feedback.
Yeah,
from
I'd
the
say that
sites.
patients that were interested in low carb diet were very interested in about it. The patients that weren't, obviously the overwhelming majority weren't interested in low carb diet or changing their diet significantly. But the ones that did were very motivated to do so.
That's great to hear. All right. Molly, what about for your PO? What worked really well in the change workflow, and what was harder than you expected?
Yeah, so we got some really great feedback from our clinical champions on the use of the handbooks. I actually had a handful, even just today, actually asked if they could have more. So they are continuing to use those with their type 2 diabetes patients. I've had some practices tell me that they're also using it for weight loss. And so I think it's something that was a big success for us. It did allow patients to receive that basic education and resources without taking too much of the provider's time. And it gave them something that they could refer back to. So we really feel like the handbooks were successful. The thing that was harder, OSP supports independent practices. So each workflow in each practice is different. The practice does what works for them. We have single physician practices and we have larger practices. And so staff size and EMRs, they're all different. We don't work on the same EMR. And so just OSP didn't create a workflow that we asked our practices to follow. We made suggestions and we helped troubleshoot. But in the end, the practice really had to own this process so that it would work for them. And we did see some challenges there, making sure everything got done the way it was supposed to.
Yeah, I imagine that must have been a huge barrier to have, so many different workflows and processes to navigate through. As you said, everyone might have, different practices and clinics may have a different EMR and a different workflow. And so I can definitely understand the challenges of the difficulty of creating a standardized workflow process. So I acknowledge that, and that's but it's great to hear. It sounds like the handbook was that a resource that you were able to disseminate to all of the practices and generally received positive feedback from all of the practices you work with that you yeah, that's great.
Yep.
All right. All righty. Last but not least, Sam, what kinds of what are some of the successes and challenges that you faced?
I think successes was the overall buy-in from the start of the project. Even from selecting it, everyone, felt that was best for our area. And then revising the education, I thought there might be some pushback because I know, care managers find things they like and that's what they like to use and they're aware of. But everyone was really open to the suggestion of using the MCT2D tools. So that was nice. I think after the first survey, with it going pretty well for getting the patients to complete the survey, I didn't think the second survey would be as big of a struggle, but it was hard to get, the patient to buy into, completing the whole process of the survey. So that was challenging for us.
Mm-hmm. Okay. So yeah, challenges of the survey dissemination, but that's great to hear. Overall, there was overwhelming sort of positive, buy-in from the practices, and positive feedback about sort of implementing these changes and the QI focus into the providers' workflows and receiving positive feedback from that. That's great. All right. Okay, everybody. I think the next question is about, let's see. Oops. Okay. What advice would you give to other practices and POs? And I believe there are practices on the call today from varying POs, trying to make similar changes. So what piece of advice would you give to them?
I would say use the resources provided by MCT2D. There's a ton that's out there on the website. We're able to use a lot of the provider resources to train our care managers and even to make the other materials that we handed out to the patients. We heavily relied on the resources provided by MCT2D. We wouldn't really be able to do this without those resources and that support.
All right. Thank you, Alex. That's great feedback. So really kind of going back to the resources that we have available, we have a ton of resources available in the MCT2D resource library, not just around low carb, but really around CGMs, medication. So really, that's a great plug to kind of, check out what available resources are available as we continue to expand our resource library. All right, Molly, what would you say in terms of an advice that you would give to other practices and POs?
I will echo what Alex just said about the resources on MCT2D's website. They are fantastic. Cannot say enough good things about them. We use them all the time. Our care managers use them all the time. I would also say if a practice isn't asking for help, it doesn't mean they don't need help or that they totally understand what's going on. So I would say something that I learned as the project coordinator is just to check in often and give those like personal check-ins. So maybe not send so many emails, but pick up the phone and do a phone call or, something along those lines. So it kind of comes back to a bandwidth thing again, making sure somebody at the PO can give that personal touch and outreach to the practices would be helpful.
That is really, really valuable feedback, Molly. Thank you. As you said, yeah, just because practices are not asking for help doesn't necessarily mean that they may not be struggling with some of their workflow processes. So yeah, having those, as you mentioned, like opportunities to kind of get together with the different practices from the POs and the clinical champions meeting to huddle and kind of discuss and share what's been going well and maybe what are some areas that the practices are struggling with can be a great opportunity to can be a really great catalyst for change and for quality improvement. All right. So thank you for that advice. All right, and Sam, what would you say as your piece of advice for other practices?
I would say that if you're surveying the patients, to make sure that the survey's short and easy to read for them, and that like you're asking questions to find a result. I just feel like patients get bogged down with so many surveys and so many questions that, we need to make sure it pertains to them and their care. And then if you're going to like implement something and follow up, that, you schedule a follow up for that time so that you can help remind them and go over things with them.
That's great advice, Sam. Keep surveys short and sweet. And I think that's also something that I try to keep in mind. I know MCT2D as a collaborative, we share a lot of surveys with you all. So really appreciate the time you take to for all of the surveys. It really is a great way to gather information and for us to identify how we can best support practices and patients. As you said, keeping them short, concise, and sweet is really necessary to prevent burnout and not to bog anyone down. So, and then as you said, following up if, in response to those surveys is a really great way to touch base again, to communicate, keep that conversation going. And yeah, that's great. Thank you. All righty. I believe this is the last. Oh, there's a few more questions that we've got. So there can be some competing thoughts on how things should be addressed and accomplished. What barriers of opinion did you face, if any? And how did you achieve consensus or buy-in? What were those conversations like?
I don't think we really had a lot of difference in opinion. All the providers really liked the idea. I think the biggest feedback we got in our initial discussions is the provider saying, I don't know anything about low carb diets. You know, how am I supposed to do this? And that really then falls back on us to show them the materials that are available to say, okay, you know, you watch the training here, and then, you know, we'll have another discussion about this. And eventually, you know, we're able to come up with a process because we did give a lot of flexibility to each office on how they wanted to implement their workflow, and sitting down, talking to the provider, talking to the care manager, and just really having a conversation with them about how it's going to work for their practice.
That's great. Having that flexibility it allows for each of the practices to really kind of shine their individual and unique qualities too, and really implement what they feel as their unique practice would best be suitable to implement as part of their workflow. So I think that's really great that you had that individualization and that the way for each of the practices to really implement workflows that are unique to their practice. All right. Molly, how about from your PO, were there any competing barriers of opinions that you faced? And if so, how were you able to resolve those and achieve consensus?
So we didn't experience anything too crazy. I did, talk to some of the care managers that are embedded in practices to see at a practice level maybe what were some barriers and things. And one of the care managers did share with me that there were differing opinions at the practice level in terms of who should introduce the survey. So was that the responsibility of the MA? Was that the responsibility of the physician? Where in the practice should that come from, and just how to approach those recommendations. So you emphasized, some doctors wanted to emphasize that they got the incentive, the $20 incentive to get them to do the survey. Others wanted to emphasize the health benefit. When it came right down to it, we left that up to the practice in terms of what best suited them for a workflow, but that was something at the practice level that was shared with me in terms of some differing opinions.
Gotcha. Yeah, thank you, Molly. So it sounds like similar to what Alex had shared with us. It's, the overarching sort of QI initiative around the low carb approach was there, but you really kind of had the practices had the ability to really sort of take forth elements of what they would like to implement into their workflow based on what works best for their practice. All right. And last but not least, how about you, Sam?
I would say it's pretty much the same. We didn't have trouble getting the buy-in and to make the change of the education. I think the hardest thing was in the second survey to continue to keep morale up, because they were facing such challenges with getting patients to do the survey. So just kind of reiterating the importance of the survey and that they were doing a good job, and that it's not just us that's struggling. Everyone seemed to be struggling. So I feel like that was the biggest challenge towards the end.
Gotcha. Yeah. Thank you, Sam, for sharing that. And I thank you for sharing that feedback and kind of, the challenges of maintaining the patient and sort of practitioners' engagement during the second survey was challenging, and definitely I recognize that. And kudos to you for kind of continuing, the efforts there and doing what you can within your PO to really keep the engagement up and keep that positivity going during the survey collection process. All right. All right. What would you say is your biggest takeaway from this past year? This from kind of the beginning of the VBR year to now as we kind of approach the end of this the VBR collection year, what would you say is your biggest takeaway from the whole process?
I think it's that patients are stubborn and changing patient behavior is hard. It takes a lot of follow-up, and the provider can't do that all on their own. It's going to take a whole team to do that. It's going to take the medical assistants. It's going to take the front desk. It's going to take checkout. It's going to take the care managers, and they all have to be part of the process in order to make that change.
Takes a whole team. Yeah, I love that, Alex. Absolutely. I mean, we are all human, right? And I think just like how it takes a village to, to care and to raise a child, I think when it comes to healthcare, it just kind of shows the importance of the different members of the care team and really the impact that they have on the patients and patient care and improving outcomes. So yeah, thank you for that. I think that's a really great takeaway. There's very little that we can do, I think, on our own, right? It takes definitely a team. All right, how about Molly? What's your biggest takeaway?
It's kind of funny. I took some notes before, to prepare for this, and what I have here is change is hard. So I'll echo exactly what Alex said. Yes, change is hard. Changing behavior is hard. Changing a workflow and a practice is challenging. And our practices, they need more support. That was our biggest takeaway.
Mm-hmm. Yeah. Change is so hard, especially behavior change, right? And as Molly, as you're a dietitian and you work with, patients likely every day and kind of encouraging them to make behavior changes. It's so hard. It's really, really hard to change. So kudos to you and to everybody working tirelessly day in and day out. All right. What about Sam? What's your takeaway?
I think patient feedback is invaluable and it can help to improve processes and education in the offices. And that us as a PO, we still have a long way to go as far as I think the support that we can offer to the offices and things like that.
Mm-hmm. That's fantastic. Yes, I think you're absolutely right. And I echo that. Patient voice is such an invaluable part of our healthcare. If we are able to listen to what our patients are telling us, I think it can really only benefit the practice and our patients' care and outcomes as well. All right. Oh, we've got 2 minutes left. Oh my goodness. This I think what we'll do, okay. I think what we'll do is I'm going to skip this and go to the last question here. What is one thing you would like MCT2D to do to help you achieve your goals with regard to operationalizing this intervention for patients?
I think we'd like to see some education modules for care managers to present to patients for group type classes. Things like having agendas, PowerPoints, handouts for that group education would be something that would be very helpful, and I think would be the next step in our low carb program.
Okay. Yeah, that's great feedback, Alex. Thank you. And I'll take that back to the team. We are currently planning a curriculum for a what we might call a train the trainer type of workshop. So, and we're going to be starting and piloting that on the low carb initiative. So more exciting news to come as we develop that. But thank you for that feedback. All right. How about Molly? What would you say is one thing we can support you and your PO on?
So OSP is exploring the option of doing some group education. So it would be something that myself, and our other RD, who is a CDCES, would likely lead. So we're in the exploratory stages of this plan. We think that that might be a better way to support our practices, get more dietitian access to those patients. So in terms of what could MCT2D help with that, for like what Alex was saying, some curriculum could be helpful, something along those lines. I also think it might be helpful if MCT2D could provide a list of dietitians that do educate on the low carb, because Rena, as you know, a lot of the hospital dietitians don't do low carb education. So if they go to those diabetes classes, it's not low carb education that they're receiving from those dietitians. So if we had like a low carb dietitian list or a low carb friendly dietitian list that we could potentially give to our practices, that might be helpful.
Okay. Yeah, that's great feedback, Molly. Reach out to me about the group class as you develop the curriculum and kind of the design of that. I can provide input from what we have done at here at Michigan Medicine, and then also to get you that list of dietitian or practitioners who focus on the low carb intervention. All right.
Thank you.
Absolutely. All right, Sam, what it would be your one thing that we can help support you in?
We must all be on the same wavelength, because I had written down group visits. I think that's a way that we can help at the PO with diabetes care. So that's what I have written down, just best practices for implementing group visits. We've never done them since I've been here. So any insight would be helpful for us to look into that.
That is great. Yeah, thank you, Sam. Let's definitely touch base. I know we'll have another follow-up to review and discuss the second round of survey results. So we'll definitely keep that on our agenda to discuss more. Thank you all so much. The last thing is just a quick reminder. So please make sure to use this link to sign in to the Learning Community event today. It will help us keep track and ensure that you receive the VBR credits for attendance. Let me see. Oh,
So yeah,
Jake.
Lifa will be sending that out via email after this with the slides.
Okay, perfect. Jake, do you mind putting the link in the chat if you don't
Yeah,
mind?
I can put the link in the chat for folks right now, but like I say, you'll get it via email
Okay.
as well. And we switched
Wonderful.
that just because we had to keep putting it in the chat. Give me 1 second.
All right. While Jake puts the link in there, I wanted to thank you all so much for joining today, especially to our panelists, Alex, Sam, and Molly. Thank you so much for coming on today to share your PO's experience with the Low Carb Initiative this year. We all received some really invaluable feedback, and we're very excited to continue supporting you and working with you moving forward.
Thank you for having us.
Yes, thank you.
Absolutely. All right. Thank you, everybody. And have a great weekend. Forgot to say.